All right, we're going to go ahead and get started. Hello, welcome. My name is Grace Sullivan Zirkle. I serve as the Director for New Student and Family Programs, which means I have the honor and privilege of helping you all as students transition to the university, both through communications and programming over the course of the summer, but also through orientation activities this fall. We are so excited that you all are preparing for your Duke journey, and we are excited to prepare or to present some information today to help you in that transition. So our summer transition series is an opportunity for you all to hear directly from experts on Duke's campus about the student experience and critical services to support you in your time here at Duke. On that note, our theme for the day is staying well in your first year. This is part one of two summer transition series webinars that will focus on this content. Before I hand things over to our colleagues that are here, I am going to go through a few housekeeping items. So the Zoom today, this is a Zoom, it is being recorded. You are going to be able to ask questions. So there is a Q&A feature at the bottom. If you have questions throughout the presentation, that's a time or an area for you to submit those questions. We would encourage you to listen and then submit questions because we know that some of them will be answered as we continue through the presentation today, but know that there's an opportunity for you to ask questions. A lot of our responses will be answered live, so that students who are listening later on the recording can hear those answers, but know that some of them might be answered directly to you. If they're a personal question or a repeat, we'll try to get you some direct answers. And there are a lot of people behind the scenes on this webinar that you may get direct answers from in the chat or in your Q&A. We have disabled the chat, so we're asking if you have questions to put them through the Q&A so that we're just looking in one place for those. And again, the webinar is being recorded, which also means that if you missed an answer, you'll be able to listen to it later. So know that all of this information will be kept for you and recorded. We ask that you just wait about 2 business days so that we can get the transcript up, but then we will post the recording to this webinar in the same place where you registered for the webinar. With that, I am going to hand things over to our team in student health, and I am going to start by handing things over to Dr. Hunter Spots. Thanks for being with us today.
Thank you, Grace, for the introduction, and I want to thank everybody for being on the webinar today and your interest in the services we provide here at Duke in the wellness space. On the slide here, you see our beautiful building. It's on the corner of Tower View and Union. For those of you familiar with the campus, it's right across the street from Cameron Indoor Stadium, and where, as you can see, the chapel is in the background there, so we're right in the heart of West Campus. Our office is on the second level, which from this view is the street level from Tower View Road. And then on the third floor, the floor above us, is counseling and psychological services, who we'll be hearing from in a future webinar. Next slide, please. And just to give you an overview of our location on a map, again, we're the purple star on the left on Tower View and Union. The blue star is the chapel and West Campus. The red star is the location of our emergency department, and the entire medical campus is on campus. So in addition to student health, students have access to the Duke specialty clinics, which are on campus, and as well as the hospital. And the black star on the right is East Campus, where freshmen live, and of course, there's shuttle service between the campuses, and then as upperclassmen, students live on West Campus. Next slide, please. So as a primary healthcare clinic, our hours are Monday through Friday, 8 to 4:30 p.m. And then Thursday, slightly different hours. We're closed on the weekends, but we have 24/7 nurse coverage by phone. And this phone number, 919-681-9355, is going to come up a lot any time of day or night, and including on the weekends. You can call and speak with a triage nurse who can give advice in terms of, whether something's an emergency and needs to be dealt with in the emergency department, could be dealt with at one of our local Duke urgent cares, which are in the vicinity, or it can be seen as an appointment in student health. Additionally, once students have signed up for a Duke MyChart account, they have access to messaging their provider through secure messaging. Those messages, however, are not meant to be, those are for non-urgent messaging and general questions. But for urgent advice, there's 24/7 access to a nurse to speak with. Next slide, please. As a primary care clinic, we offer a full range of students. We're taking care of our entire student body population. We have over 17,000 students at Duke. Roughly 6,500 of them are undergraduates, and then 10,500 students are grad or professional students. So not only are we seeing students who are in the traditional undergraduate age range, but we're also seeing students who might be in their later 20s, 30s, or even older with our grad and professional students. We often get asked, is it required to use student health as your primary care provider? No, it's not required, and especially for students who might be living more locally in North Carolina and who want to continue with their primary care physician, you're welcome to do that. And also, of course, students can still maintain relationships with their home primary care provider or specialist. That being said, we do have the full range of specialty care as well at Duke. But in our primary care student health clinic, we offer women's health, sports medicine, nutrition counseling, travel medicine, allergy shots for those who need allergy immunotherapy, and we offer lab and x-ray services. We also do telemedicine, and so a lot of students take advantage of this with video visits, and we are able to provide care through video visits. And next slide, please. Yeah, and so another way students can engage with it, especially to establish care, we offer welcome to student health video visits, where students who have never been to the clinic can have a video visit with one of our medical providers. They can update their medical history, go through some of the preventive screening questions that we often go through in an in-person visit, and also then get scheduled for services in the clinic for anything they might need to be seen for preventive health. And this is a really great service that I think helps get students engaged with student health and get established with us. Next slide, please. So we're staffed by, for our medical providers, we're staffed by physicians, nurse practitioners, and physician assistants. This is just a sampling of our providers. I see patients and as well as direct the clinic. Dr. Melanie Trost is one of our full-time physicians here at Student Health, and she provides a lot of women's health care and also sees a lot of patients for eating disorders. And then coming over from family medicine community health at Duke, we have Dr. Kovis, Dr. Johnson, and Dr. Lobach, who each provide some specialty care for our students inside of our clinic. And all of us are faculty physicians with family medicine and community health. We have another physician, Dr. Fan Zhou, who's not pictured here. I just didn't happen to have a picture for her for this. And Franca Alphen, our director of nutrition, who's also family medicine and community health faculty, who you'll be hearing from later in this presentation, also sees clients in our clinic. Next slide, please. So in addition to primary care here at Student Health, as I mentioned earlier, students have access to a range of specialists in the Duke healthcare system. We can make those referrals for students as needed, including students who are coming in and maybe they've already been seeing a specialist at home, but need to get established with a specialist here at Duke. In student health, we have referral coordinators who can help assist with arranging the referrals to the specialists, as well as who are in the Duke Health system and even other specialists outside the Duke Health system in the community as needed. Also, something to know, if a student is seeing a specialist, say in their home state and are coming to Duke and would like to get established with a specialist here, or or seeing a primary care physician at home, those physicians can also refer directly to Duke specialists. So that's something that occurs frequently here at Duke, as Duke is a tertiary care medical center. They're referring specialty referrers from physicians all over the region. But if needed, we can assist with those referrals as well once students arrive here on campus. Next slide, please. So as typical of any primary care office, we do our visits by appointment. There are multiple ways to schedule. Again, calling 919-681-9355 will get you in contact with someone who can schedule an appointment. We also do have some limited online appointment availability with students who have signed up for their Duke MyChart account. We are not able to put appointments with a wide we are not able to put all of our appointments on this platform, as because we do reserve appointments for same-day visits. And so to preserve that same-day capacity, we don't put all of our appointments on MyChart. And if a student is not able to see what they need on MyChart, they can still call, because we can have other appointment options available as well. So that's multiple ways to get an appointment. And again, there's also messaging features within their Duke MyChart account that they can utilize. Next slide, please. So as I mentioned, we have after hours, students can call and always speak to a nurse. We are not geared to be an emergency department. So true medical emergencies should be a 911. And again, we have a emergency department right here on campus. And there are Duke urgent care locations also in the vicinity of the Duke campus for other after hours, but less emergent situations. Next slide, please. And so next, I'm going to turn things over to our immunization coordinator, Ellen Crawford, who's going to go through some important information about immunization compliance.
Thank you, Dr. Spots. My name's Ellen Crawford. I'm one of the nurses here at Duke Student Health. I want to spend a couple of minutes talking about the immunization process, because I know it can be confusing and complicated. So we're going to try to give you a few tips here to help you get through the process. And please know that we are here to help you get through this process. We have, if you can see here, an email address on the slide, immunizations@duke.edu. Please feel free to utilize this email address if you have any specific questions for us when this slide presentation is over, or as you start processing, getting your records together to submit to us during the summer. So the North Carolina state law requires that all incoming students show proof of a certain set of vaccines to come to school at the university level. You have until the 30th day of class to complete these requirements. If the requirements are not completed by that 30th day of class, then the registrar does have the ability to remove you from class, and your Duke card would be deactivated. So this is why we take this very seriously. We do not want this to happen to you. You've worked too hard to get here. We want you to be able to stay. So again, we're here to help you through this process. The deadline of the 30th day is separate from the deadline you've probably seen on forums and in Facebook, as far as the June 15th deadline. The June 15th deadline is the day that we ask all of the students to submit their records. We ask you to submit your records by this day, or as close to this day as possible, to give our staff time to review all of the records that we get. We have a tremendous amount of papers that we have to go through, and we want to get to everybody before that first day of class. So please know that that June 15th deadline is not the deadline you have to have everything completed by. We just want you to submit your records as close to that date as possible. The gateway stays open to you at all times. It does not close on June 15th. So feel free to continue to upload records as you may need them. Can you send me to the next slide, please? Thank you. This is a screenshot from our website, giving you the steps for immunization compliance. On these specific steps are 3 links that I wanted to point out. The first is the tuberculosis screening questionnaire, which is also part of the compliance process. The second link, which is under step 4, is the actual immunization form for undergraduate students. And the third link is under step 5, which is how to access the Student Health Gateway. To give you a little brief overview of how this process works, we would like you to go and download the immunization requirement form for undergraduate students. Take that to your provider and have your provider complete it and be sure they sign and date the bottom of the form. And then we want you to upload that back into your Student Health Gateway. When you log into your gateway, you're going to be directed to enter the dates of your vaccines. This can be a little bit confusing for some people, and please know again, if you make mistakes in the dates that you're entering, we will correct them when we verify your records. We want you to enter those dates so that when we review your record, we can verify the dates you entered and make sure you have met all of the requirements. One thing I do want to mention really quickly and briefly here, because it's been a very common question this year. When you enter the dates of certain vaccines on your gateway, this compliance status automatically changes for some things that's set to an awaiting review status. To other things, it says no data. And to a third option, it will say unmet or not satisfied. Please know that this is a system issue that we are working hard to get fixed, but that your status will change once your records are reviewed by our staff. So don't get concerned if you type in your dates and you know you fulfilled the requirements, but that nothing is changing on your end. When our staff reviews your records, you will receive a message on your Student Health Gateway notifying you of your compliance status. So again, don't worry too much if you put things in initially and the status is wrong. It will correct itself when our staff reviews your records. We do try to get to everybody's records within 2 weeks. This can be delayed a little bit during our peak time, but we do try to respond to you as best as we can in 7 to 10 business days. The messages we send you on the Student Health Gateway, they do not go automatically to your Duke email address because it is secure, confidential messaging about your health records. So you'll get a message on your Duke email. You'll get an email on your Duke email address, excuse me, that will send you to your Student Health Gateway to read that message. I do want to just remind everybody as the summer progresses to keep an eye on your Duke email address. It's easy to forget that one, but you're going to be getting a lot of information, not only from us for insurance and immunizations, but from your programs as well. So keep an eye on your email. And when you do see a message from us, please be sure to log into your gateway to read that message. Next slide, please. I want to talk just a little bit about TB testing. So every student that comes to Duke is not required to complete TB testing, but every student that comes to Duke is required to complete the TB screening questionnaire. You can find that questionnaire again on our website. When you complete that questionnaire, when you finish it, you will be given instructions on to whether or not TB testing is required. If it is required, the TB testing does have to be done in the United States, and it has to be done after March 1st of 2025. I want to highly encourage all of you to complete as many as your immunization requirements as possible before you arrive to Duke. We do recognize that some students do not have access to some of the vaccines in some of their home countries, and that if you are not in the United States presently, you will need to come here to get your TB testing done. But if you have the ability to complete all of your vaccine requirements and your TB testing before you get here, we highly recommend that. If you do not have the ability to do that, we will hold clinics in August. And if you can take me to the next slide, that will show the dates of the immunization clinics that we will be holding. These are walk-in clinics. No appointment is necessary. They will be held at Penn Pavilion, which is between our building and Duke Chapel. So it is also on West Campus. But again, these are very busy clinics. There are long lines. When you get here, you're going to want to move into your dorm and get started with all of your orientation process. So I can't encourage you enough to, as much as possible, fulfill the requirements before you get here. Again, I want to emphasize the email address is immunizations@duke.edu. And if you have any questions for us or any specific individual needs, feel free to reach out to us at that email address. We do try to answer those emails within a few days. Next slide. At that time, I'm going to turn it over to Calvin, who is our insurance coordinator at Duke Student Health.
Thank you, Ellen. I want to talk briefly about the Duke Student Insurance and what it entails. Why does Duke require students to have insurance? It's to provide adequate coverage for medical needs as well as for medical prescriptions, and to help keep medical costs down so that way it doesn't put a unnecessary burden on you financially as far as medical services were to go. So we do prioritize the students' health and well-being while they are here at the university, and also through Duke Health as a whole. Next slide, please. We have the new projected numbers for the student insurance policy for the annual plan year. The annual plan year always runs August 1st through July 31st. You may hear it as an annual plan year. You may also hear it as a student school benefit year. They mean the same thing. The cost for the students for the enrollment would be $3,751.56, which includes the entire school year. Once again, it goes from August 1st through July 31st. It's not broken down per semester. Towards the bottom of the slide, you will actually see that we also have the new projected dental numbers, which are $353, and that is for the entire school year, which also will go through the annual plan benefit year. Next slide, please. For the waiver criteria, there are stipulations where the student can waive out of the Duke student insurance policy, and there are times where they're not going to be able to waive out. One thing is students that are an international student on a visa, on an F1J1 visa, will not be able to waive out of the insurance policy. They will be automatically enrolled into the insurance policy with no actions needed on their part. One of the stipulations to get a waiver, it can't be a travel policy. It must provide prescription drug coverage. It cannot be a short-term insurance policy, and it must provide coverage for the entire benefit year for August 1st through July 31st. It cannot stop before the annual benefit year or school benefit year, or you will not be eligible to submit a waiver request. One thing that we get a lot of questions on are about Medicaids. If the Medicaid is an out-of-state Medicaid, it's part of the CHIP program, which is a Children's Health Insurance Plans, or if it's an HMO outside of the home state, as well as Kaiser. Duke Health does not participate with those. There are no coverages outside of the home state for Medicaid, for CHIP, and for HMOs. They have to be within the host state or the home state in order to be able to be used for medical services. Kaiser does not provide non-emergency services, which is one of the requirements for the Duke student insurance in order for the student to be granted an insurance waiver. Next slide, please. For the waiver process, the students are able to submit their insurance waiver request beginning sometime in mid-June. They'll receive an email communication through their Duke email account from the Gallagher link that will be provided from the university or from Gallagher. The information will be in that Duke email account mid-June to September the 15th, which is the end of the school benefit. I'm sorry, at the end of the fall enrollment period. So you would have that time from mid-June to around mid-September, September the 15th, to submit your insurance waiver request through the Gallagher link that's posted on the screen in order for you to be granted an insurance waiver request. Once your waiver request is approved, if you're granted an insurance waiver, the Duke bursar will remove the charge from the account. If you submit an insurance waiver request and it's pending or denied, you're going to receive an email communication to let you know the status of the waiver request. Next slide, please. The enroll or waive period for the fall is mid-June, of course. Once again, mid-June to September the 15th. Students will receive the notifications from the Duke email account. Once the insurance portal is open, you will be free to submit your insurance waiver request if you're insurance waiver eligible. Once again, if you are an international student on a visa, F1J1, you will not be able to submit an insurance waiver request. You will be automatically enrolled into the insurance policy without any necessary steps that you would need to take. Next slide. In our research tab here, we have the QR codes that are posted for the Gallagher Student Portal, which is an active code, and the Student Affairs Portal, which is an active code. Either one of those QR codes will actually take you to those particular areas. For the Gallagher Portal, if you try to go to the portal now to try to submit an insurance waiver request, it's going to tell you that the portal is not open yet. You can't submit any waiver requests, or you can't enroll yet. So you're going to get a kickback email letting you know that the portal has not been open yet. That of course will start sometime within, we'll say, the next week to 2 weeks. That portal will open and you will be able to go in and submit your insurance waiver request through that Gallagher portal using that QR code or through the link that is provided through your Duke email account. For the student affairs, if you have any questions regarding that, we do have an FAQ page that will pop up with the QR code that is posted. And if you have any specific questions that you want to ask the insurance team, we do have our website there, which is the shs-insurance@duke.edu. Myself and the other insurance team will be able to answer your questions we'll try to say within 24 to 48 hours. Just keep in mind that we are coming into the enrollment period and that the phone calls and emails are going to start coming in a lot faster. So it may take us a little bit more time to get back to you, but we will answer your phone calls and emails as soon as possible. Next slide. And now for nutrition, I'll turn that over to Franca.
Hi, everyone. My name is Franca Alphen. I'm the Director of Nutrition Services. Good afternoon. I'm just briefly going to talk about what services we offer. If you scan the QR code, it will bring you directly to the Nutrition Resources website. And we have quite an extensive website. It starts out with talking about how to make an appointment, which is slightly different than what Dr. Spots was reviewing as far as how to make a general appointment. We have basically a link on our website. You can click on that link and you can just ask for an appointment through that link. And then I will get back to you, or one of the other dietitians will get back to you to schedule that. These, again, are part of your health fee. So as long as your students are enrolled in classes, this is covered by the health fee. And we offer extensive services, literally anything from any student dealing with an illness that might have a nutrition connection. We have students that might be interested in becoming vegan or vegetarian. We have students that might be interested in managing their weight. So we're happy to meet with students, even those that struggle perhaps with some disordered eating. We're happy to meet with students for any reason that relates to nutrition. We really want to ensure that students recognize that nutrition is important, even at this young age when they're first coming, and certainly a difference it can make to their well-being long-term. I will say we're not a high acuity clinic. So if we are meeting with students that we feel need a higher level of care, that is something that we will talk amongst a treatment team, usually with a medical provider and often with a therapist, if it's specific to a disordered eating or eating disorder event. And then we will make a recommendation to the student of what we feel would be in their best interest. But really, all of our services are outlined on the website. If you have any questions, certainly you can feel free to ask any today under the Q&A, or again, feel free to peruse the website just to familiarize yourself with all the services we have available. And also, there's an entire library of information of topics that we cover. So I hope you enjoy the website. Look forward to meeting all of your students, certainly in the fall. And I'm going to turn it over to Grace.
Actually, I'll jump in here. I want to thank everybody for their participation in this webinar. We look forward to assisting you. And just by saying, in addition to the 20,000 patient visits we do each year, just our immunization compliance activities during the summer, our insurance administration are huge undertakings for student health. And so there's a lot that goes into those. And I thank Ellen and Calvin and Franca for their contributions to these efforts. And again, starting in September, a student can register or schedule a Welcome to Student Health video visit. And that's, again, a great way that students can establish their care with student health. And so we look forward to seeing everyone in the fall. So Grace, I'll throw it back over to you.
Wonderful. Thank you so much, Dr. Spots. Thank you to all of you on this webinar today. This is the time for questions. So if you are listening to this and you need some clarification or have deeper questions, please feel free to submit those in the Q&A function below. Again, we'll do our best to answer as many as we can in the time we have left. So, great. One student asked a question about immunizations. Can they take a picture of their immunization form and TB screening questionnaire and upload it as a picture? Will that satisfy the requirement?
As long as we can actually see the whole form on your picture, sometimes pictures get cut off, or they're, the formatting can be a little bit off, but as long as we can actually see the entire form with your name and your date of birth and your provider's information, all of the information, that would be fine. You can send that picture and upload it to your Student Health Gateway.
Wonderful. How does a student actually enroll in the dental plan?
The student can enroll into the dental plan through the Gallagher link that'll be provided to all the students once the enrollment period opens. So you in that Gallagher link, you would be able to enroll into the medical and through dental as well. So both links will be open in that Gallagher link that'll be provided.
Wonderful. A student is asking about transferring prescriptions. How would you advise them to transfer prescriptions from their home pharmacy to the pharmacy at Duke?
So there's two ways they can go about that. First of all, they could visit the pharmacy here, the Duke Campus Center Pharmacy, which is located on the first floor of the wellness building, and discuss with them a prescription transfer. Typically, pharmacies can assist with those transfers. And in any situation where there might be a barrier to that transfer, they can just visit a provider at Student Health and discuss the situation. We can see what we can work out.
Dr. Spots, is there anything, part of that question was also about international. I didn't read that. Is there any additional
international
guidance that would be provided if it's an international student?
That they would need to see a provider. Yeah, international transfers are very difficult just through pharmacy to pharmacy. So they would need to schedule an appointment with a provider at Student Health. And that's something we routinely work with, especially at the beginning of the school year where a lot of students are coming from other countries. And so that's something we routinely assist with.
Great, thank you. Someone's asking about a specific prescription. I think there's a general question embedded in here too, but someone's asking about Xolair. I might be saying that wrong. Delivery and injection. Can we get it shipped to Duke? And do we need to schedule for injections or drop-in?
So typically, if students have injectable medications that they need to come in and have a nurse do that for them, we can do that. Typically, the way that works is we schedule an initial appointment with one of our medical providers who goes over the prescription and the all the things that go with that medication, just to make sure that it's things are appropriate and we have appropriate prescribing instructions. And the reason for that is so we can create an order for our nursing staff going forward. And then going forward, typically we can have visits just with one of our nurses who can assist with that medication administration. Now, in terms of a specific medication, that might be something we would need to, on a case-by-case basis, discuss with the provider because there may be insurance implications with that. So it's hard to give one general answer for that.
Great, that's very helpful. Um, will TB testing for international students also be available at the immunization clinics that were mentioned?
Absolutely. We will have all of the vaccines that you may need as well as TB testing. And all of the TB testing, the charges for the TB testing, the vaccines will all be billed to your insurance company. There's no payment up front, but the charges will be billed to your insurance company. I do want to encourage all of you who are coming to us to get your TB test done. We do a blood test, so please try to come as well hydrated as possible. I know a lot of you will be traveling, doing a lot of traveling before you arrive, so just try to keep in mind as much as you can before you come to our clinic to hydrate as much as you can. And it is fine to eat before your TB test. You do not have to fast for that.
Great. A student has an immunization record that's been signed by their doctor in the last 12 months. Can that be signed, something that already exists? Can that be submitted in lieu of the mandatory form?
Typically, we can accept those. It's hard for us to really determine whether or not we can accept it before we actually put our eyes on it. So what I would recommend is that you go ahead and submit that record to us and let us look at it, because if it does include the information that we need, we can accept it.
Great. Can we reiterate again, high level, what is needed to waive insurance? Is it just as simple as submitting proof of insurance?
So in order to waive the insurance, the student's going to have to go into that Gallagher link, and it'll walk them through step by step on what they or need to submit. So the first thing they're going to need to do is make sure that their insurance meets all the Duke Health waiver requirements. And then they're going to be required to submit information, first and last name, the name of the insurance carrier, and then we may ask them a couple other questions about their insurance. They're going to have to upload a document of their front and back copy of their insurance card for verification through the Gallagher system.
Great.
And I'm
And
going to
again,
add something, Grace, I want to add something to that. The reason we have this waiver system that we require insurance is we want to make sure that all students are adequately covered when they're here at Duke, and that Duke is in network for their insurance, so that if they did incur something catastrophic with a large medical bill, that they're not left paying out of pocket because they didn't have adequate insurance for being here at Duke. So this is really for the protection of the students that we have this requirement.
great. And again, students are going to receive more information, including the notification that that portal is open very soon. I think Calvin said in the next week or two.
Yes, that should be out within the next week or two. So that information is going to come to the student's Duke email account with the instructions on how to enroll or waive through the Gallagher link. And then, of course, they're going to get reminder emails until they actually complete the process before the end of the deadline. So they have from mid-June until September the 15th to submit that insurance waiver request in order to be granted the insurance waiver if their insurance meets the Duke Health waiver requirements. So they'll receive reminder emails until the process is done.
And there's another question that I think sort of speaks to or is a little bit addressed by what Dr. Spots just said, but I do think it's important to ask, is that process of going through waiver or enrollment also apply to local students that have health insurance here locally in North Carolina?
Yes, it does.
Great, thank you. All right, a few questions back to immunizations. Another example, Ellen, is it okay to submit vaccine records directly downloaded from a state Department of Health or another health system?
Yes, it is. It is. We accept those electronic state immunization records. Again, just be sure when you submit them to us that all of the pieces are contained with your name and date of birth and that information, and make sure none of that is cut off when you upload those.
Great. In the Student Health Gateway, there's an upload option under not required for clearance, such as the immunization form and consent to treatment. Are those also needed to be fulfilled by June 15th?
That's a great question. So the consent to treatment form, we do ask that everyone complete those before they get to do, just so that we have that on file for you for your first visit here. It is not part of the immunization compliance process unless you are under the age of 18. So we do want you to complete that and upload it. It does not have to be done by the June 15th date. The immunization requirement update form is where you will continue to upload documents as you may get things over the summer. For example, if you have not completed your TB test when you initially send us your records, if you need to come back in and send us your TB test in a few weeks, that is where you would upload your new documents.
And I'll just add, just with that consent to treat form, that just becomes one less thing that you have to do when you're checking in for that first visit at student health to help things go a little bit more smoothly when maybe you're not feeling so well. So
to our students watching, we are nearing the end of the questions that are submitted. So if you have something, this is your opportunity to write in and submit your question for our esteemed colleagues here. Is vision coverage included? Maybe this could be as services at Student Health, or the question could be, is it included in the student insurance plan? I'm not sure which way to interpret the question.
It's included with the student medical insurance policy. With the student medical insurance policy, it is for minor and major medical services as well as vision. Dental is a separate enrollment. So that's why you have, through the Gallagher link, they'll have two different links they can click. One for medical and vision, and the other one is for dental.
Great. That is the end of the questions that have been submitted. So I do want to take, oh, just kidding. One just came in. Okay, this is great. This is why I prompted students to think about things. Is the Duke Health Insurance typically accepted by providers in other states? This is a great question. Thank you for asking this.
Yes, the Duke Student Insurance has coverage in all 50 states and is not limited to just North Carolina only. So you can go to other states to use the coverage. It is part of the Blue Cross Blue Shield network. So any provider that accepts Blue Cross Blue Shield will accept the student insurance policy.
Wonderful. Back to you, Ellen. When uploading the TB form on the Duke Health website, do I need to upload anything else under that drop-down upload, or just the TB screening?
You can just upload the TB screening under there. If you do upload your immunization record, we will also see it. But you can upload your TB screening questionnaire along with any TB testing that you have done. You can submit those together.
Great. Are glasses and contacts included in that medical vision plan, Calvin?
Yes, so the student would be covered for one eye exam per calendar year, not per benefit year. It has to be a calendar year. They can get glasses or contact lens, or they can have their eye exam. And then if they need glasses or contact lenses, what they would have to do is pay for those up front. They can submit a claim reimbursement form with a copy of the receipt to Blue Cross Blue Shield, which we can actually provide the claim reimbursement form. They're going to attach a copy of the receipt and send it into Blue Cross Blue Shield, and then they would be reimbursed up to $100 for their glasses or contact lenses. Now, of course, if they got glasses and contact lenses and it's less than 100, then of course Blue Cross Blue Shield would reimburse up to 100. So if it's not $100, if it's less than $100, they're not going to send you the whole 100. They'll send you what the dollar amount is.
Great. All right. With that, we are going to wrap up our Q&A portion. I want to say thank you again so much to all of our panelists in front of the screen, additional colleagues that are behind the scene, spending your time with us and making sure that we're answering pressing questions for students that logged in live today, but also for all the students that will watch this recording this summer and help in their transition to Duke. So thank you so much for all of your time. I'm going to have my colleague behind the screen share, or behind, yep, there we go, share screen really quick. And for all of our students, thank you with us too. We hope that this was helpful to help you feel prepared for your arrival to Duke. We would be remiss if we did not remind you that this is an ongoing series. The Summer Transition Series continues next week with Financial Aid 101. We would highly recommend this for any student that's receiving financial aid to make sure you attend this session. It'll be June 17th at 4 p.m. Again, this current webinar is recorded. If you give us 48 hours, we will have this posted to our webpage under the STS website so that you can re-listen to all of these answers and make sure that you have all the critical information needed to have a smooth transition to Duke. So with that, thank you again to our panelists. Have a good evening, and we'll see you next time.